Good morning, everyone. My name is Dean Mazzarella, Mayor for the City of Leominster, and we're live today with the assistance of the staff here at LTV, Leominster.tv. And so you can watch this streaming. You can watch this streaming. You can watch this live. We are taping this, so you can watch it later on if you miss it or if somebody else misses it. So we'll try to bring you up to speed as to what's happening by the minute. So we're going to be doing two press conferences per day. I believe the first one we'll do on cable, and then we'll simulcast through our WLPZ radio station, PLZ, LPZ. We'll simulcast through that at 9 in the morning and then also at 4 in the afternoon. So we'll keep you up to date locally. I know that all the other state news agencies and federal, the national news agencies are bringing you up to speed as to what's happening, but locally is what affects you directly. So I will start off by letting you know that a phone call on the way in, the Leominster Health Alliance or Health Alliance Clinton, Health Alliance Leominster, they are not allowing visitors. Obviously, if there's an end-of-life situation or a traumatic experience, then obviously they will let you in, but they are not allowing visitors to any of the campuses at this time. They are ramping up for an exterior unit that will be set up so that they could do testing. That is not set up just yet. Let's see what else I can tell you this morning. School is closed. Now, we wrestled with this last week. Is it better to have students in the classroom, in school, or is it better is there more risk associated with having students out? So we try to keep them open as long as we could. We went to a 2-day closure, then a 2-week closure, and then yesterday the governor ordered all schools closed for 3 weeks. Grocery stores are open, pharmacies are open. Check the hours because some grocery stores, et cetera, are beginning to close a little bit earlier so that they can restock. But pharmacies continue to be open. City Hall at this time is open. The library is open. So city workers are showing up for work. And our Emergency Operations Center at 37 Carter Street is open, and it is now our central fusion center for the coronavirus. And this is pretty much where all of our departments will be operating out of. And this is also the location where we will share with you later on the phone number that you can call. And in fact, let me just go through this if somebody wants to put that special number that we have. And what we're setting up is one phone number that you can call at City Hall and then just press 1. It'll bring you right down to emergency management. They will have all of those questions answered for you. If you have any questions, do that through Facebook. And if you do that through Facebook, I can see those questions. Now, we have a lot of questions that I don't have answers to now, and that's the purpose of having these phone numbers set up. So the phone number right now that you can call is 978-534-7500, and then it'll prompt you to a menu. Just hit 0 for operator. It will take you right to our staff at City Hall. We're going to give you another number later on today, and that's for emergency management. And that's our Emergency Operations Center. They are going to, they will keep building layers of questions and answers that we'll also put on our website and Facebook page so that we can let you know exactly what's going on. Now, a couple of things that are unclear to us just yet that we don't have answers on completely is they have said that all restaurants will be closed for indoor dining. So the questions are, if we catch a nice day, is outdoor dining allowed? And obviously, it's okay if some of these restaurants, it is acceptable and permissible for restaurants to do takeout and to do home delivery. So we're going to get you an updated list, working on it right now, of restaurants that are going to be doing takeout. Now, the obvious ones are the pizza places and the national chains, but there are some restaurants that typically you wouldn't think so much about takeout. Well, they're ramping themselves out to better service their customers by doing takeout. Question was asked this morning about small pubs, when there's only sometimes 4 or 5 people in some of these places, under 25. Do they have to close? Well, right now, yes. The answer is yes. So there are a whole lot of situations that we don't have answers to at this point. If it gets to the point where City Hall has to close and the library to the public, then we will stay open. But if you need a form, if you need information, we will set up outside the building so that you could come to that one location. If there's a form, a marriage certificate, a birth certificate, anything that you might need, we want to make sure that you have that, and we wouldn't allow, and I'm not saying this is right now, this is in the future. So at this point, at 9 minutes past 10, City Hall is open, as well as public library and other municipal buildings, not the schools. The schools are doing, they have 4 schools, and they're also going to be going to certain housing developments. And from 7 to 9 every day, you can go through the parking lot at each of the flagpoles, and that'll be the location, and they will hand you a bag with breakfast and lunch in it, and they'll have things like apples and snack bars and those kinds of things. So let's see. Uno's is open for takeout and curbside pickup. There's just tons of, we'll get all those things. Christina's, I know, has a takeout menu and specials going on. So all this stuff is evolving. We're going to get and read to you the list of everything that you're going to need to know, that you will need to know about how things affect you locally. So Katrina Kuchar is here. She's the nurse for the city of Leominster. She's going to sort of go over, and because I know that when you get sick and you wake up and you're kind of not feeling well and you think, could this be the virus? And so the Center for Disease Control has put out some guidelines. Katrina, if you want to come up to the mic and just sort of explain what those areas of caution are.
So good morning, everyone. And so as you all know, we're in the middle of this pandemic, and the reason the governor has asked us to take these measures is so that we can slow down the spread of the virus. With the kids being out of school, it's not an extended vacation. It's a time to stay home so that we self-distance from each other. So the coronavirus symptoms would be a cough and a fever. And if you're experiencing these things, especially if you've had a contact with someone who is positive, or you've had recent travel outside of the country, make sure that you're calling your primary care provider first, letting them know that these are your symptoms, this is the contacts you may have had, and what would they like you to do. If you're having emergency symptoms where you can't breathe, you're having mental status changes like confusion, your chest, having chest pains, those are things that you go to the emergency room for. But first, if you're having manageable symptoms, you just don't feel right, call your primary care first, get direction from them, and stay away from other people. If you're feeling ill, even in your own home, you gotta sort of socially distance yourself even from the people in your own home if you're not feeling well. If you do get a diagnosis of COVID-19, then we're talking something different. Then you've been infected, and we go down a different path. But for right now, everyone should be washing their hands well, 20 seconds, soap and water, using hand sanitizer liberally. Again, that's 20 seconds with an alcohol-based hand sanitizer. It has to be 60% or more alcohol. You're going to scrub your hands. You have to rub your hands for 20 seconds. You just don't kind of put it on, and you got to scrub like this. Good respiratory hygiene. That means coughing and sneezing into your elbow, not out. If you sneeze or cough into your hand, go wash them. Tissues, one and done. After you use a tissue, wash your hands. Stay away from sick people and stay inside if you're sick.
Okay, thank you very much.
Yes.
No, that was good.
Excellent.
And as things evolve, we'll certainly share them with everybody. Check our website, our Facebook page. We'll be pushing out this information through all department social media sites. And again, at 4 in the afternoon, we'll do another update. So every day at 9, and then another update at 4, unless things change. And then we'll certainly bring that to your attention. What we do know is school is closed for 3 weeks. Restaurants cannot have indoor seating and can do takeout. Pubs are supposed to be closed. If they offer food, then they can do takeout food. Right now, cities, buildings are open. There are so many questions coming here. So in the area of employment, so there are some businesses that are closing. And so the question is, do I qualify for benefits? Well, we have an agency in Leominster. It's a state agency called Mass Hire. It is what used to be called the unemployment office, and then it was later called the career center. It's the one-stop sort of one-stop operation, everything under one roof when it comes to employment and unemployment. So I will be, when I leave here, I'll be talking to Jeff Roberge, who's the director there, and getting that information so, again, I can share that with you so that, it's difficult. And let's get to the difficult part of this. Obviously, the elderly, those students whose parents have to work. If you don't work, for some people, you don't get a paycheck. If you don't get a paycheck, you can't pay the rent, you can't buy food, you can't basically survive in a world that's of commerce that we have. So we're trying to get answers for those people, for people who have had to leave their kids at home. We're trying to find out whether or not we can do small areas. And again, this is a balancing act here. Do you leave, if you have 2 or 3 kids, do you leave them home? I can tell you, you didn't want to leave me and my brothers home. And, so we've got to balance out some of these things. Will the Boys and Girls Clubs stay open? Are there little community centers that will stay open? We've got to get answers to that as long as they're under 25 and as long as people are practicing proper hygiene. So that is a concern of mine. As I said, there is a large population in the community where they don't have a stay-at-home parent, they don't have a grandparent or a guardian or somebody that can be home with them or supervise them. A lot of people work out of town. So, there's all these things that are of concern, and those are my concerns right now. And then we get down to the businesses, many small businesses that, struggle every day, and we're worried about, what happens to them. And so the federal government is talking about loans, but some of these businesses don't need another loan. They already have loans to pay. So in particular, if you can do business locally, a lot of businesses are trying to stay open for a lot of reasons, but also because they don't want to lose their valued employees. So anytime, any chance you get that you can do business locally, it is certainly appreciated. That's right. Bartenders who need to support their household. Now what? Exactly. And we're going to get you answers to these things, and that's why as we go through the day, there'll be more and more layers, more in Q&A, so that when you make those phone calls, when I get to another press conference like this, I have more information for you. This is all developing now. Things changed drastically yesterday when the governor sort of closed a lot of the businesses, and things have changed. We've gone from 2 to 3 weeks in school closures. One thing I'd like to say is, listen, it's going to be hard for some kids to concentrate and to learn outside of the school environment. All teachers are on standby. Teachers are available to answer questions through email. Kids were sent home with a packet and a kit on Friday in the event that we did have to close the schools. That was good planning on their behalf. And so there are a lot of things that if you have internet access, there are a lot of places that you can find. Scholastic, for instance, is putting a platform up so the kids can continue to learn. Google Classroom is another platform. Packet and a kit on Friday in the event that we did have to close the guys. I don't know what happened, but I talked to myself over myself. Sorry about that. Just a technical problem. But at 10:17 here on Monday morning, lots of answers to questions that we're getting as I speak. And so, as I said, the teachers, they worked hard all year to get kids to where they are now and students, and they don't want them to lose that. So they're available to help students during the workday. So every student should have an email address. We're trying to get students that don't have internet access or don't have some sort of a mobile device or a home device, try to get them connected so they can continue to learn. I think what you'll see in the coming days is a lot of different, a variety of educational platforms where kids can continue to learn. Safe sites that they can continue to learn and discover and keep and retain what teachers and staff have worked for so hard through the school year. That's, part-time jobs. That's why I say a lot of businesses are trying to stay open so people don't go and leave, the company or the small business and get another job. But There are places that are hiring. Somebody just said Home Depot and Lowe's are both companies that are hiring. There are places that are hiring. I would suggest you go to masshire.gov. And again, they have listings of any jobs that are open. Again, as we progress each minute, every day, everything is changing. The big thing is if we can contain this, we're going to be out of this a lot sooner than later. We've got a lot of calls for people that want to volunteer. That's great. I think when people struggle, we do much better. We tend to check on those kids that might be latchkey, a next-door neighbor who might check on the kids to make sure they're okay, lend a hand, whatever it is, an elderly neighbor that you might have, somebody in your apartment building, keep an eye on them. This is, loneliness becomes a big issue for a lot of people that are once had a little bit of social activity going on in their life. And if you're watching TV nonstop, it could get a little bit depressing. This is like news coverage 24/7. So get away from the TV once in a while. And again, this local access TV station is great. We have a lot of local TV programming. We have a local radio station. Detach yourself from all of this and for a little while so that you don't get too deep into this. But just remember, proper hygiene, keep your social distance and your personal distance of a minimum of 5 feet. And city services and buildings and departments are still open. And if you have a problem and you believe that you may have the virus, do not just show up at the emergency room. Do not show up at your doctor's office or one of these med stops, these urgent care centers. Call ahead, please. Call ahead. Now, if this is sort of life-threatening and you're in a particular situation that requires 911, then by all means call 911. But call ahead so that they're prepared for you when you get there, and they can also have a phone conversation and do some diagnostic while they have you on the phone. So lots of questions, as I said. Are there still going to be AA meetings, support groups? What happens to kids with special needs? What happens to those with disability? I think what we're trying to gear up for is more in-home sort of contact, so that bring services to people's homes as much as we possibly can. And that's where we're working with other agencies across the city and the state. But for us, this is now 24/7. This is not, we go home at 4 o'clock and it ends for us till the next day. We're on top of this. We are in touch with every medical agency there is, state, federal government, hospitals, CDC, the governor's office, Mayor's Association, the Mass Municipal. We are in touch and on podcast. We are on phone conferences all day from different groups, and so we're trying to keep up on that. That information will be sent down to our Emergency Operations Center. So when you call and you have a question, we can get you those answers. Let's see. I'm not sure if I've forgotten anything, but by all means, if I have and you have a particular question, our staff at City Hall is ready, and 978-534-7500, extension 0, and they'll help you out and get you the answers to those questions. I'll have you that phone number later on at the Emergency Operations Center. They will handle the bulk of the calls. You can call the school department, 534-7700. You could call them, and they also have a hotline set up. I was there this morning. They have staff. Again, they're supplying 4,500 students per day with a bag of things like apples and snack bars and healthy choices. They are set up for 4,500. They are at 4 different schools, Johnny Appleseed and Francis Drake are 2. They're also bringing the food at lunchtime to some of the housing developments, Riverside Apartments, Litchfield Street Apartments, et cetera. So all of this, we'll just keep building off of this. And again, we have 1,400 school and city employees ready and willing and able to do whatever is necessary. We will get through this, and we want to get through this healthy. So nursing homes, assisted living, I believe all of them. The hospital are not accepting any visitors. If it's a life end-of-life situation, obviously they're going to make accommodations. But, you know, if we found in other countries where they have taken these aggressive approaches, you know, they've really been able to nip it in the bud and, you know, slow it down and get to the other side of it so we can get back to a normal lifestyle. Now, the things I worry about, and I continue to say, are those that can't, you know, 44% of Americans count on that weekly paycheck. They are living from paycheck to paycheck. So I worry about them. I worry about those kids that have to be left home because their parents have to go to work. I worry about them. I worry about the educational retention. I worry about those kids in special needs, those students that are in special needs, who every day count on those real committed and devoted and really just give it all. Teachers and those in the education world who give it all to these kids every day of the week. And how do we, you know, and for some of these kids, a day or two away from it, and they lose they lose what they've gained. And so all of that is of concern. And our elderly and disabled populations, again, are of concerns. Those are our big areas. As far as if you work in a factory, those are, you know, again, those are still in operation. The supply side of what goes into a grocery store or a retail environment, those, they haven't shut down. So I know people getting excited about buying food ahead of time and toilet paper, and I don't know I can change people's minds other than to let you know manufacturing is still open and alive, and the supply side of that part of the industry continues to operate. And so think about the people, you know, we may create another problem by buying up, you know, having half the population buy up all the necessary items that are needed for the other half of the population, which creates a whole nother problem. But grocery stores and pharmacies are remaining open. Check about home delivery on certain supermarkets that offer that. Also, the service where you can drive up, place your order online, and then pick up, because some of those may be limited or discontinued, or they may not have the products that you're looking for. It's about 10:25 here. This is Leominster.tv, LTV. You can watch live streaming all day by going to Leominster.tv. You can also go to WLPZ, and you can catch them on WLPZ.org. And they stream live. That's our low-powered radio station. They are keeping you up to date. They have it staffed all day. And we'll just keep you up to date on what's happening in and around the city and locally. And we'll be in touch, and we stay in touch. We have a 4 or a 5 o'clock conference call with the hospital. We have a number of conference calls during the day, and if we need to come here to update you, we will. We also, at our Emergency Operations Center, have the ability to do the same thing that we're doing here. Thanks to LTV for setting us up. We have that ability to go over local cable and bring you up-to-date information. So a lot going on. Thank you, everybody that's offered to volunteer. We're going to give you that number later on. But in the meantime, 534-7500, extension 0. And we'll get you, and we'll so happy to have so many people. The outpouring is incredible. They're willing to do just about anything to help us out, to get us through that. And that's really what is going to get us through this. We can't do it all on our own, and we're going to need your help in certain areas. So thank you for that. So we're going to sign off here at at Leominster.tv. And again, we'll update you. Check our website, Facebook page, all our social media sites. And if there are any questions you need answered that you don't see there, 978-534-7500, extension 0. So for the crew that came in this morning so that we could do this special presentation, thank you. And thank you to all. And be safe and stay safe. And remember, we'll get through this. And we're a tough city and we're tough people. We'll get through it. We'll get through this together. And, you know, just help each other out, right? And stay healthy. Thank you and good morning.